be aware that.
Okay. Well, Swayze's here.
Thank you. Hey guys, it's Dr. Jude. And I got this sweet little beagle named Wesley. He's sleeping. He's anesthetized with some propofol, so he doesn't know what's going on. And he is with Proud Pups. And the story is he ran loose for a while, him and his girlfriend. His girlfriend got hit by a car and died. And they finally found him, and something ate the back end of his legs, and it is nasty, so I'm going to forewarn you that it's pretty gross. But you can see there's lots of damage there, and so lots of muscles and tendons torn. I see a bone. He's using it though, which is impressive that he can stand on it. And so we are going to treat this nasty wound and see if we can get it to heal. I like sugar, and we'll put some sugar on it and get rid of that bacteria. He's on antibiotics, pain meds. He also has a big bite wound there. He has testicles, but you can barely see them. He's got one on his neck. He had a collar that was embedded in, and so they cut that off. So we're going to clean that up, put some sugar on that. So it's going to be an amazing, miraculous healing, I hope. We would amputate that leg, but that infection goes all the way up into his groin. So I almost feel like you got to get that under control and see what it does before you cut that off, or you got an infected wound from that nasty wound there. I wonder what's like. Why is it just slipping?
Is that covered by dripping?
Yep.
Okay, so just put it on Aaron's desk.
Yep.
Okay.
And we'll wait and run everything at once.
Okay.
And so I told her she can go ahead and go.
Yeah.
Good.
I just didn't
I'll start up here because it seems smaller. So we're just going to get all this hair off there. And, you know, bite wounds like this, a lot of times there's dead tissue underneath it. It's kind of an iceberg effect. So it looks like a hole, but underneath there'll be pus forming. And then it opens up because 80% of the iceberg is under the water. So we're just going to clean all this up. Yeah. He had a bath earlier. It was disgusting. And he actually kind of enjoyed it. Look at that nasty goo coming out of there. Yeah. So I bet you underneath there's a lot of damage. And it's going to become more evident over the next week or two. It didn't get his little boys. Surprisingly. I bet you sucked those up hard, buddy. I would. Alright, so we're just going to claw. So all of this is kind of really swollen and edematous, and show my foot. But it's a little cold, which is concerning, because if it's dead, it will come off. And this blackness is definitely not healthy tissue. So we will do some wet to dries on it with some sugar and see what happens. I do feel a pulse down there, so I think he has blood flow. But ultimately, he might lose this leg. I would just like this to calm down so I can cut it off first, because it's going to be up in his pee-pee there, so I can't really amputate it yet. Oh gosh, it's gross. You'll be amazed at how much better it looks even tomorrow, just from a couple days with the wet to dry antibiotic. With sugar on it, it will get a lot better. Look at the outside of that leg. I mean, it's just gangrene and black. I might lose this leg. Whew, that's bad. That looks completely dead. And he's got some more here and here. Ooh, lordy. That's bad. BAD. Okay. I know. Drugs are good. Just sleep, Wesley. We got 21 people. Anybody say anything good? Poor baby. My goodness. Good evening. So just nasty. Nasty, nasty, nasty. Surprised there's no maggots. I ain't gonna lie. There might be that we just ain't seeing yet. Because he's been outside for a while. Oh yeah, there's our medial saphenous vein. You see it? What's left of it? Yeah, it's ruptured. Collateral circulation should kick in though, because we can lose those. We're going to see what it looks like tomorrow, but it sure is cold down here. Whew. I wish y'all had smell-o-vision. I always talk about how good it smells. I'm feeling it. I'm smelling it. I'll cut all that black nasty off because it ain't going to come back. Woo, Lord. This is why I really like veterinary medicine, because you never know what you're going to get. I get excited about this because we can make a difference. And he's going to die if we don't, you know, so you got to do something. We had a pie meature and a cat today that was a sick cat and had actually ruptured. Cat's lucky to be alive, so we spayed her. And we had a cat with bladder stones. So we got those bladder stones out. I know, you feel it just a little bit. That's right, but lay back down. Propofol's wearing off. And he's not feeling all his tissues pretty dead. We had a dog that came in to recheck liver values. And it has a bladder full of stones. So things come in 3s and 7s. So I fully expect another PIO to come in tomorrow. And or another cystotomy. And, makes me want to gag a little bit. So, sugar is bacteriostatic, and bactericidal. It will kill any bacteria that's in there. And we got him on 2 antibiotics. We gave him convenient, and we'll start some Baytril tonight. And then surgical scrub to clean out a lot of this nasty topical stuff, and just to make it smell better, because it smells like death. This is the part I worry about most. We can heal this. It's that bottom part that's so cold and black, but I bet you it'll look better tomorrow. It's gonna get worse before it gets better, right? So, whew. And that skin will actually cover over that bone. It's kind of crazy how the body heals so fast. Whew. You'll set that right there for a minute. All right. Oh, came off.
You want to do any blood work or heart rate 40X on?
Yeah, let's do 40X on. Okay. That'd be cool. Probably got something brewing.
We'll get that.
James hasn't come and gets in out of the finger panel. I like to know.
I can grab one
I like to know what the white one is.
No, he said I should know.
So when I say we use sugar, we use table sugar, which is funny to me that you can put sugar in stuff. We also use honey, Manuka honey. I don't like it though because the texture of it is terrible, and it just makes a mess. And I don't feel like it works as good. A lot of people swear by it, so they both work in the sense that
A couple people want you to explain why you're not amputating again.
yeah, so the infection is all the way up into his groin. So when I cut that skin there, I'm just leaving infection there. So I want to get this to heal down a little bit and see what it's going to do. Because, and he's using his leg. He's standing on it, isn't he?
Yeah.
I mean, he's putting weight on
Yeah.
it.
Yeah,
So if you can save a leg, save a leg. But I'm worried that if I do that and then the infection gets where my incision is, I can't get it to heal very well. So, and I'm not saying that we won't amputate it. If this doesn't come back and warm up in the next 48 hours, we'll do it on Tuesday probably. But you'll be amazed at how much better it looks. Just getting it cleaned up and nasty. But I'm worried, honestly, that I won't be able to heal the amputation site, and then you can't go any further up, and you're on his back and his penis, and if that falls apart, we're in trouble. So I'd rather, and I think I can heal this part good. This is the part I don't think I can heal, maybe, possibly. So if I can get this part to heal, then I can amputate good, or at least get better clean margins. This down here, I don't think, I don't know about, we'll see. It may or may not heal. So I like to put a little water, a little sterile saline on some 4x4s, and squeeze out a little extra. And then I'm going to split those in two, and I'm going to put sugar on them. Put some sugar in there. Woo! Like a crazy baker. I'm going to put that, pack that in there. I like a challenge is why I'm not amputating. Amputating would be boring. And he's eating and happy, so if we can get it to heal, I'd love to get it to heal and let him keep his leg. Ain't no fun or glory in amputation. And if we get this to heal, that's amazing. And you'd be surprised. We had Orbit the puppy a couple years ago that had his neck ripped out that smelled and looked worse than this. And you can see his trachea and his jugulars and his esophagus. And it was this on a 6-pound puppy. We got him to heal fine, and he kept all his skin. And so a few bandages might make a difference. And if it doesn't, I'm not opposed to it. I just needed to heal a little further up because I can't amputate all the way up to his penis. I could, but he wouldn't like me.
Why are you using sugar, and how is it going to aid in wound healing?
Yep, so sugar, I explained a minute ago, is bactericidal. So it causes the cell wall of bacteria to mess up, and it kills them. And so it fights local infection. He's also going to be on some powerhouse drugs, antibiotics systemically. And so to kill the bacteria that's in that. And if you could smell this, you would believe me that there's a lot of bacteria in there because it smells like death. And so wet to dry, that's going to pull all that infection out, and that sugar's going to help. So tomorrow we'll change it again, and we'll change it daily for the next couple of days and see what it looks like. And if it's not healing and it looks terrible, then hopefully this has healed down some, so I have some healthier skin there. But it'll be fun to follow and see the difference a week will make. I like wounds. They make me happy. Orbit, our little puppy with the neck, ended up having buttons to pull his skin together, and he did great. Gotta think outside the box sometimes. Alright, so there's that one. We'll change it again tomorrow. Let's flip him over and look at his other side, and let me look at his neck there.
The sugar question was from Ireland.
Oh, cool.
Yeah.
What time is it in Ireland? Like 12 hours early or 10 hours maybe? Something like that, 8 to 10 hours a lot. Yep, there's that one. I know. Sorry. That one's not bad. It'll heal pretty good even without anything on it tomorrow. I'll wrap it a little higher, but I think it's okay.
It is 10:30 p.m.
Wow, it's only 4.5 hours.
Watched it before bed.
Yep.
Yeah. So he's got this big wound up here that they thought was from a collar, or it could have been a bite. But, put 2 fingers in there, and super hard and crusty. So we're kind of going to do the same thing up here. Kind of a harder place to wrap, though, because it goes around his neck, and he ain't going to like that. And we could do it, I guess. I might throw a couple sutures in there and do a time bandage because he'll heal better and it won't slide as much, which will make me happy. So 201 girl. Give me 20 PDS actually. Yeah, James, we got a good one for you.
I see that.
Gotta see that. You have to go back and watch the video when you get home.
Yes, ma'am. What happened?
He got attacked. There's a stray dog roaming around. His girlfriend died, and then they finally caught him, and that leg's kind of gangrene, the chronic nastiness. So we're doing wet to dry with sugar.
Yes, ma'am. Is that a bite wound?
Yep.
Mm.
That might be from a collar, they thought. I'm not sure.
That's pretty deep.
Yeah, it sure is. I'm going to show you if I get in there because I accidentally moved it. Okay.
Oh, you poor
I
baby.
know, he's a sweet,
Not
sweet
that
bagel.
old either.
No, we called him Wesley. She thought he looked like a Wesley, and I agree.
Alright.
So we're going to put this little Tom bandage on his neck. That way it's on here and we don't have to wrap it all the way around his neck because he ain't gonna like that. I wouldn't like that.
That way you're going to have to pack that or?
Yeah, I'm going to put some sugar in it and some 4x4s to pull out that infection.
Yes, ma'am.
You should be able to smell that one. It was right.
Was it really?
Maybe
So do you think you will be able to save it with all that?
the distal end is real black, so we may have to amputate, but the infection extends all the way up to his penis. So
Okay.
I gotta let it heal a little
So
bit.
I guess that's why his testicles are all red then.
Yeah, I said, lucky you didn't grab you by them, right?
Yes, ma'am. That don't leave hurt.
Yeah, it could have been easy. I could have amputated those
Yeah,
easier.
it'd be a lot easier.
We could have took care of two problems.
Yeah, he don't need them no more.
No, that's probably why he's out hunting.
Roaming
fighting,
around, yeah.
He's a sweet boy, though. He ain't done nothing
Very
mean.
pretty.
He is cute. Oh, Wesley.
Would you be able to apply a cone because of the neck wound, or would you
I
anyway?
can, but I hate cones myself, and if he's messing with that leg, we will. He hadn't been looking at it, and we like t-shirts better just because they tend to be more pet-friendly and client-friendly. Clients love that we don't use cones most of the time unless it's some out of reach. And his leg, I mean, if he's chewing his leg off, then
He didn't bother until after I gave him a bath and was messing with it.
yeah. And he was sleeping when we went back there, so I don't think he'll need a cone, but if we need one, we put one on him. It's going to be padded good, so it shouldn't hurt it, but Hopefully not. And that would be a reason to amputate if he starts chewing the distal end of his leg off. Obviously, we got to do something, but I would like for him to have it heal for 48 to 72 hours or so and just see what it's going to do. Because it looks bad right now, but it'll look better in a day or two.
Why is he not intubated right now?
Because it's a short procedure, and I just used propofol. And he's with the rescue that we work with, and not that it's wrong to not intubate, but to keep costs down, have a nurse sitting there checking on him. And simple procedures, a lot of times we don't intubate. And this is taking 5 minutes or less, 10 minutes. So I feel like it's safe. And there's an expense with anesthesia, $200 or so. If we can do this, like this. Because he's going to get sedated a lot over the next week, probably, because we're going to have to knock him out. If we spent $290 every time, they'd say no. They wouldn't, because they're awesome. But most people would say no, because that's a lot of money.
Now, how often would you have to change this bandage?
Daily.
Daily?
For the next... And he might let us do it. That one's... He's probably going to be knocked out for a few days.
Do you have to put the sugar on there daily? Mm-hmm. Is there like a certain amount that you use? Or?
I just pour it on there.
You gotta measure with your heart.
Okay.
Yeah. You sprinkle it with love.
All right.
You missed the back leg. I was like, woo! This is usually our time to sing Pour Some Sugar on Me. In the 80s.
Yes, ma'am.
I like that song a lot.
Best time.
It is. Y'all know, have you heard that song?
Definitely.
Okay. Yeah, I was like, does
Yeah.
everybody know that song? Some of these babies don't. Do you know Pour Some Sugar
Yes,
on Me?
ma'am.
Okay.
You definitely got a lot of babies in there.
Some sugar on me. Oh, I'm hot, sticking sweet. From my head to my feet,
Just
yeah.
want to know who that is.
Def Leppard, she
Oh,
said.
okay. Oh,
I sometimes
I'm
mix
sorry.
them up with Poison, I'm not gonna lie. And,
Do y'all know the drummer only has one arm?
yeah, I do remember that.
Did he the whole
lost-
time?
No, no.
Pretty good
He
drummer,
lost
wasn't he?
his arm after their second album, Pyromania. He lost it in the car wreck
Oh, yeah, and he still drummed.
and had to totally relearn how to
Yeah.
drum.
I thought I had a bone tumor one time, and my nurse is thinking, who's going to be my right arm? They can just scrub into every surgery and learn my ways.
Yeah.
You were on the list there, Warner.
Oh, great.
Yeah. You and Aaron.
Irony
and-
enough that I'm left-handed. That probably would have
Well,
been
you could
a
be my
poor...
left hand.
Okay, I was like,
There
that would have
you
been a
go.
poor
Maybe
choice.
if it was my left hand.
I was like, that would have
I'd
been a poor
choose you.
choice
If
to
it was
be
my
my
right hand,
right,
I'd
to
choose
be your
others.
right arm.
Yeah.
Dr. Brock's mom says, bless all you do.
Oh, thank you, Dr.
That's
Brock's
the
mom.
truth.
It's like, I'm coming.
We miss you today, Dr. Brock. It's been a day for the books.
Mm-hmm.
It always happens when one of us are gone. It gets a little loud. That's good, though. I like it. That's what I like about my job.
Now, are you going to leave this wound back here open, or are you going to pack it with sugar?
It's not too bad, so I said tomorrow I'll wrap up higher and get it, but I scrubbed it good tonight, so I think it'll be alright.
Because that don't look that deep.
No, and it'll heal pretty fast.
Yeah.
And so I think just cleaning that daily would take care of it. He's got two on the other side that look similar. That would heal pretty good. So we're just putting a little backpack on him, a little back neck. So a whole lot easier than having a big wrap all the way around his neck and less supplies.
My boy had that on his
Yeah,
side.
he did, didn't he? I forgot
Yes,
about his
ma'am.
healing. Yep, we healed him.
Yes, ma'am.
And he looked like he was going to slough everything, and he did. And so we like wounds. We ain't afraid of no wounds. All right, and there's
Did a
is
great
that
job.
there's a tick on his eye to get it off.
Yeah, I got it off. It was dead.
Heartworm testing. All right, look at it.
I don't think we've run a
Slight positive for Wikia.
Oh, of course he is. So he's got a leaky. He had a tick on his ear, probably from running loose and having a tick on him. We'll start him on some doxycycline too.
And what's that for, Lyme disease?
It tests for Lyme, Ehrlichia, and anaplasma, and heartworms.
Okay.
So 1 out of 3 is not bad. And
Yeah, I was surprised.
yeah, I know, me too.
So,
yeah,
how long does it take that propofol to wear off?
It should be coming off.
Yeah.
It's not too bad. Look at-
Yeah.
He kind of looks like who's that cartoon character? Dewey? Is there a cartoon character that's a beagle named Dewey?
No, you're talking about the ducks? Dewey, Huey, and Louie?
No, it's an
what I
old
think
one.
of.
It's an old cartoon and Deputy Dog. There's a
I know who Deputy Dog is.
yeah, kind of a little short.
They love
But
your llama
Dewey,
strips.
I don't remember Dewey.
I'll have to look it up. I
They're
don't
some of
know.
my favorites.
Yeah.
So are we going
You
to
wake
put blood
up.
work out on this guy?
Yep, we pulled it and it's already up there.
Yep, they were getting it.
Okay, alright.
As soon as you wake up,
No.
you can have some chicken.
He is from
Some chicken when you wake up.
London, Corbin area. Is that right, Corner? Somebody asked if he was from here, and
I think London. I think
yeah,
Chris.
yeah, I think I saw the bit. Yep. Is he able to breathe? Yes. If you watch him, he is breathing on his own. So propofol doesn't completely knock you out, and it just makes you relax for a minute. And so a couple minutes he'll be out, and he'll wake up, and he'll be fine. Loving the llama scrubs, Julia. Somebody commented on that. Lisa Varner said, "Hey guys and girls, why the gauze on the neck?" Because he has a big wound there, and I didn't want to wrap it all the way around his neck because if it slips, it could cause breathing problems. So we put a little backpack, so suture, a towel and bandage to keep that on there so that we can get it cleared up because it's nasty and infected too. How come he's not intubated? Because it doesn't need to be. I've missed your lives. We missed you too. It's 10:30 in Ireland.
Oh, wow.
Yeah, I would have thought it was later, but I guess not. Good. I'm just reading all these things. He's kind of cool.
Famous guy.
We are. That we get people from Japan and Australia.
Really? Well, I love watching your videos.
I think it's fun. This is better than Dr. Pimple Popper.
Yes,
See,
it
we
is.
need to get on Animal Planet or something, so this could be our show.
I tell everyone about that inflamed uterus that
Oh, yeah.
your daughter popped at one
We
day.
had another one today.
Did you
A
really?
cat, and it had ruptured in
Oh,
there.
wow.
I agree. I think it's better than Dr. Pimple Popper. Will you just leave the puncture rooms open at the back? Yes. They're pretty small and pretty superficial. So tomorrow I'll wrap those in there and we'll clean them every day. They'll close on their own within a week. And so not too bad. Are there stitches under the gauze? No. So there's stay sutures that I just put around the wound. So if you look, there's a stitch, and then I use umbilical tape to tie that bandage on because it's a hard place to wrap, and that way we don't have to use so much wrapping, and so it doesn't choke him because it's kind of got a little chunky neck. And so those stay sutures will just hold it in place. And then tomorrow I'll cut the umbilical tape and place new ones and a new bandage, and we'll take that off there, and it'll pull out some nastiness.
Oh, that way.
Yeah, yeah. We got one from Oregon,
That's okay.
New Hampshire,
I'm sorry. I'm sorry.
Walpole, New Hampshire. I've never heard of Walpole.
No, ma'am.
NH. Okay, I was like, that's New Hampshire, right? H is little, so I was confused. I've never been to Walpole, however you say that.
That I don't know.
I like Oregon. I do like Oregon. Thank you for explaining. You're welcome. A lot of fun.
Super sweet. Because you've got sugar on it.
Sad the baby didn't get medical attention immediately before infection set in. I agree. You know, these dogs are out and it's hard to catch them sometimes, so it takes a little bit. Washington, D.C. Haha.
So the video's
Florida.
already online with
Yep.
the leg?
Yep. When I finish, I'll post it and it'll go online. So he's waking up. You can see him sitting up, and we should go be a vet. I don't know how to say her name. I'm having some reading problems. How would you say that? Marichka? Marichki? You should go be a vet, Marichki.
Is that a warm blanket?
It is fun and very rewarding, and I like it a lot. Best profession in the world. So there's his little chicken foot. Hopefully it's not a chicken foot tomorrow.
You're the best dog in the world.
Aw, thanks, James. I saw you, Rosie. Oh, it's 72. It's too late. Well, you don't look 72. You look like a teenager in that picture. Marichka's 72.
It's never too late.
You can come hang out with us, Marichka. It's fun. Gina, I love you too. Look at that sweet boy. So he's got good pain meds on board. He's got an antibiotic on board. He's getting ready to eat dinner, and we'll start him on 2 more. 1 for Ehrlichia, so he's positive on the Ehrlichia, negative on heartworms, Lyme, and anaplasma. So that is good. Marika, the J is silent. That makes all the sense in the world. I was like, that is hard to say. Yes.
I like it.
Somebody said it is harder to become a vet than a doctor. You are a smart one. Well, thank you.
Still being back there, or do you want him up here today?
Put him up here so I can watch him.
I was
Yeah.
gonna say, do you?
This is Julia. She is a 4th-year student from LMU, and this is her first clinical rotation. So she graduates next May, and she's doing awesome. She's a rock star. She's a budding baby veterinarian, and she's great. We love her. She wants to work on horses. which horses scare me, so she's crazy. But it's fun. It is the best profession in the world. He is positive on what? He is positive for Ehrlichia. It's a tick-borne disease that can cause bleeding issues. And so he had a tick on his eye that we found, so he's probably been out for a while. And so we'll put him on doxycycline, and it will heal it. Marika is a Dutch name. I like it. If I was going to have another baby, I'd call her Marika because I like it. But I'm done. I'm too old for that. Come hang out anytime. I was in D.C. this April, and it was hard. For a 8th grade trip, we went to 100 monuments and museums. I became a special ed teacher, but I love the animals. Best job ever. That's an honorable job, for sure. Currently waiting on my results for my vet nursing degree in the next couple of weeks. Love the work, fair play, guys. It is fun. I agree. That's awesome. Good job for taking your vet tech test. You waking up, Bubs, huh? All right, let's pop him in his house there. All right, well, I do have a cat if anybody wants a cat. Oh my gosh, that's a little piggy. We got Eliana. This girl has leukemia and she's precious. Yeah. Like I said, this is Onyx, who's crazy. That's my dog. I just dyed her. That's Bubbles. Bubbles has, it's her sister. We call her Boobale. She has hydrocephalus, so she probably won't live long. She's 5 months old. We just gave her a haircut and a hair job because I like colorful things. She's getting ready to get washed. Yeah, she got hydrocephalus, so her eyes are sideways. Hi, Bubbles. She's huge. Yeah, she's not little no more. There's Adele. Hi, Adele. So Adele was born without an anus, so she had a tree-shot ani. So we opened it up, and she was actually pooping out of her vulva. And look at that little booty hole. She's doing well. She's pottying and able to potty now, so that is good. All right, I'll post some more tomorrow. Oh, Wesley. All right, I'll post another video tomorrow, so thanks, guys.